whenever the Spirit moves you.
According to the Alameda County Public Health Department, quote, parts of East, West, and North Oakland have experienced the most persistent levels of high poverty in the county. In the face of long-standing disinvestment, people living in these places often have especially few resources and weak infrastructure to support health. I am specifically going to talk about West Oakland and how the poverty in that community affects how they have few resources and weak infrastructure. I'm going to even more specifically talk about the Black residents of this community, which make up a large majority of the West Oakland population. I'm going to inform you all about how living in the West Oakland area affects the overall physical well-being of its Black residents by explaining the air pollution and healthcare system. First, I will talk about the air pollution in West Oakland, along with some of the effects that it has on the residents of its community. The neighborhoods in West Oakland have a higher percentage of air, water, and soil pollution because of the location of the city. There are more chemical and fuel release sites in these communities than in wealthier neighborhoods of Alameda County. According to the article GCSE Bite-Size Air Quality, the chemicals and fuels that are released in these sites are coal, petrol, diesel fuel oil, vinyl chloride, and chemicals from large volume tanks and railroad cars. Coal is burned to produce carbon dioxide and petrol, diesel fuel, and fuel oil are burned to produce carbon dioxide and water vapor. A reason that these chemical and fuel release sites are in these poor communities and not the wealthier communities are because they cannot afford to build the proper infrastructure that they need in order to keep their city safe. They also do not have as many resources to keep the city safe, which includes money, a big resource that they lack. These sites are also built in these poor areas because the white people who lived in these areas were moving out when these chemical and fuel release sites came in, and then the minorities started coming in, so they found it a good time to put these chemical and fuel release sites in when the whites were moving out and the minorities were moving in. According to the Alameda County Public Health Department, quote, West Oakland is in the top 6 to 10% of statewide zip codes that are disproportionately burdened by multiple sources of pollution, end quote. Due to this immense amount of pollution, asthma rates in West Oakland are very high. For example, according to the Alameda County Public Health Department, during the years of 2011 to 2013, children under the age of 5 living in West Oakland are around 2 times more likely to be hospitalized for asthma than the normal rate in Alameda County. Also, another effect that these chemical and fuel release sites have on the community is that they may seep into buildings and contaminate those areas in the buildings. According to California Department of Public Health, quote, vinyl chloride was detected in the crawl space of 3 abutting residencies in 1999. Their detection indicates people in these residencies may have inhaled some of the contaminants. Next, I will talk about West Oakland's healthcare system and the effect it plays in the residents' well-being. The West Oakland Health Council, which was founded in 1968, helps run around 7 medical centers in the East Bay. It receives funding from the HRSA, which is the Health Resources and Services Administration. The HRSA believes that the West Oakland Health Council is not doing its job with helping the community, and because of this, they might shut it down soon. This would cause many of the patients who go to these facilities to become strongly affected by this. According to Reverend Thomas Harris, a West Oakland pastor and former longtime member of West Oakland Health Council's Board of Directors, states, quote, it would hit the area hard, and for people of color in particular, it would be an enormous hit, end quote. This council mostly helps those in the neighborhoods who cannot afford health care. According to Sam Levin, who wrote an article called The Breakdown of West Oakland Medical Care in the East Bay Express, says, quote, in 2013, 41% of patients were uninsured and 43% of patients had insurance through Medi-Cal or the Children's Health Insurance Program, which are both government-sponsored programs for low-income people. And this is all within the council, within who the Health Council helps with these medical sites. In conclusion, I talked about the West Oakland, how the air pollution and the healthcare system affects the residents of West Oakland and their health. And I hope that I helped you all understand a little bit more about this topic and why it's important.